You lose between 50 and 100 hairs every single day. That's not a typo, and it's not a problem, it's just Tuesday. Your body sheds that much hair on a normal day and you don't even notice, because new hair is already growing in behind it. So here's the real question this video answers. If losing hair is normal, why does it sometimes turn into actual baldness? What flips the switch? Here's a number that might shock you. By age 50, around half of men have some degree of hair loss, and by 70, that climbs to roughly 80%. This isn't rare. This is closer to the default outcome. And there are 6 distinct biological reasons it happens. Most people only know one of them. By the end of this video, you'll know all 6, which one most likely applies to you, and which ones you can actually stop before they get worse. Cause 1. Genetics. Cause number 1, and by far the most common: heredity, androgenic alopecia. You know it as male pattern or female pattern baldness. This isn't an accident or a deficiency. It's a genetic instruction. And the data on this is staggering. An estimated 50 million men and 30 million women in the United States alone are affected. Around 25% of men notice their first signs of hair loss before age 21. This can start far earlier than people assume. And it really is written in your family tree. If your father went bald, you have a 5 to 6 times higher relative risk of the same fate. In men, it shows up at the hairline and crown. In women, instead of a receding hairline, the part gradually widens and the crown thins. Cause 2. Hormones and medical conditions. Cause 2. Hormonal shifts and underlying medical conditions. The cause that explains hair loss when genetics alone can't. Pregnancy, childbirth, menopause, thyroid disorders. All of these disrupt the hormonal signals your follicles depend on. And the connection between hormones and hair loss in women is so strong that androgenic alopecia in women is associated with a higher risk of polycystic ovary syndrome, a condition built almost entirely around hormonal imbalance. Under this same umbrella sits alopecia areata, your immune system mistakenly attacking your own follicles, causing sudden, coin-shaped patches. There's ringworm, a fungal infection causing scaling and patchy loss. And there's trichotillomania, a hair-pulling disorder that's behavioral rather than biological. 3 completely different mechanisms, 1 category. Cause 3. Medications. Cause 3. Medications and supplements, the cause nobody thinks to ask about. Cancer treatments, arthritis drugs, antidepressants, heart medications, gout treatments, blood pressure medications, all documented to trigger hair loss as a side effect. If your hair loss started shortly after a new prescription, that timeline matters. Don't stop the medication yourself, but bring that timeline straight to your doctor. Cause 4. Radiation. Cause 4. Radiation therapy to the head. Hair in the treated area can fall out, and here's the part that surprises people. It may not grow back exactly the way it was before. Narrower cause, but an important one for anyone going through cancer treatment. Cause 5. Stress. Cause 5. A major physical or emotional shock, and this is where the science gets genuinely fascinating. At any moment, about 85% of your scalp follicles are actively growing, while roughly 15% are resting. But under serious physiological stress, as many as 70% of your growing hairs can be prematurely forced into that resting phase all at once. Here's why the timing confuses so many people. The shedding doesn't happen during the stressful event, it happens 2 to 3 months later, once those resting hairs finally release. So you'll often have completely forgotten about the surgery, the fever, the breakup, by the time your hairbrush starts filling up. This condition is called telogen effluvium, and the science fiction version of "stress made my hair fall out" is actually backed by real biology. The genuinely good news: about 95% of people fully recover within several months once the trigger resolves. This is temporary, reversible, and non-scarring. Cause 6. Hairstyles and treatments. Cause 6. And this is the one almost entirely within your control. Hairstyles and treatments. Tight pigtails, tight braids, cornrows, tight rollers, hot oil treatments, perms. Anything that creates constant pulling tension on the hair shaft causes traction alopecia. Here's the warning that matters most. If that tension continues long enough to cause scarring, the hair loss becomes permanent. This is the one cause on this entire list where the damage is genuinely preventable. Risk factors recap. Across all 6 causes, the same risk factors keep resurfacing. Family history, age, significant weight loss, conditions like diabetes and lupus, chronic stress, poor nutrition. Most of these you didn't choose. A few of them you actually can manage. So which of these 6 is actually behind your hair loss? Genetics doesn't ask permission. By 70, 4 out of 5 men are dealing with it in some form. Hormones run on their own schedule. But hairstyling damage, certain medications, chronic stress, those are conversations worth having with a doctor before they become permanent. If this helped you understand why hair actually falls out instead of just panicking that it's falling out, hit subscribe. Next week we break down what actually works to slow each of these down.